Hello guys. Welcome to SRHIN's HealthPodcast. I am Deborah Jeremiah, popularly known as Debbie Mike.
The vision for healthcare is health promotion. I remember growing up, you hear parents say this kind of thing that let him eat the sand.
Please, self-medication, run, because the money you're trying to save with self-medication, because when complications arise, the money you were trying to save,
you spend
times 3.
That's true. Okay.
A patient should know his or her rights. When you see that things are not done properly for you, you have a right to sue the healthcare worker.
How do we even know they are not properly done?
Exactly. That is why we're having podcasts like this.
Exactly. This is your best bet on health-related tips. And for today, I'm so excited because you know what? I have a wonderful guest here with me in the studio, and this person is a phenomenal woman. When you say woman of virtue, the Proverb 31 woman, you'll find it in her. She's a medical enthusiast. She's an amazing woman. It's important that when you take vaccine, you should ensure that you are getting it from a registered health practitioner, not just anybody. Just like I was insisting on giving you this injection, you have to ensure that these persons are registered. Don't just walk up to anywhere, to get that. I think that would bring us to this question: how are vaccines handled? Are there special ways to how you handle this vaccine, or is just the regular way with other injections that are being given to patients?
Okay, so vaccines contain antibodies.
Okay.
So you can't handle vaccine like the vials the same way you handle other injections.
Okay.
Yes. So, and that is why when you want to you have to ensure that there's a proper storage for these vaccines.
So it is being stored.
Yes.
Wow.
There's a cold chain system.
Okay.
Yes. So, and then also the way you also hold the vaccine, like the vial, when you want to withdraw and administer, is very important. Because if you don't do it this way, it's not going to be effective.
Really?
Yes. And imagine saying you want to prevent a particular disease, and because of let's say carelessness or not
on the part of the health
professional, yes, you end up giving placebo, like just something that is more like water, more like you're giving water.
So I think that might be the reasons why people feel that when they even take vaccines, they still get those infections they are trying, or diseases they are trying to prevent, maybe because of the way the health professionals handle those injections. Could that
well
be?
Not in all cases, but in some cases. So it's because one thing with vaccines is they are 90% effective, yes. So, and this only happens with maybe people that are not certified, because anybody that knows about vaccines, that knows about the cold chain system, the VVM, we call it VVM, vaccine vial monitor, would know that there is a way you handle vaccines, which is and that is why when you see health workers in the community, they always go around with this box. They call it Justa box.
Yeah, that's why when children see them, they start running away.
Exactly. So there are things in that Justa box to ensure that the vaccine is safe to be given out to people. Yes, because you can't just put the vials in your bag or in a plastic and then you're just walking around with it. Yes, because there is a particular temperature that the vaccine should be before it's going to be administered.
Okay. Wow, people. That's amazing. Well, we'll try to wrap up. So what are the reasons why people should actually take vaccine? Can we stress some of the reasons why people should get vaccine, why it is important that they take vaccines?
Okay, the first and major and most important reason.
Yes, Auntie Bisola, are you hearing that? The first and major reason, I'm counting. One
is that vaccines prevent diseases.
That's true.
Yes, it's just one of the surest way to prevent yourself, even though you have to take other measures. I mean, you can't say because
you've taken
I've
the
been
vaccine,
vaccinated, then you just go about doing things you shouldn't do and feel like nothing is going to happen to me. You can't act that way. Yes. So, and vaccines are also safe and effective. Yes, so you are sure that this vaccine that is for this is going to work for this. Yes, and you are rest assured because you know that at least you are more like 90 to 95% safe. Yes. And then also when you need to maybe travel out of your country or you need to apply for some jobs, they might require you to get vaccinated, to take some vaccines. Yes, it's just to prevent you, but the major reason for vaccination, for taking vaccine, is to prevent diseases. Yes.
Wow. Oh, that's quite an amazing one. So to our dear viewers and listeners out there, vaccines are very important. Like we've heard from our nurse, it's something that you should do for yourself.
Yes.
You're not doing it for us.
You're not doing it for
anybody. Doing it for yourself, because when you are healthy, that is when you can chase wealth, actually, because you cannot go after wealth when
you are sick.
Yeah, exactly. So you should take vaccine. When you see an opportunity for that, you should take. So before we wrap up,
and also,
how can people, you want to say something?
Yes, prevention is better than cure. When there is a way you can stop something from happening, why not just stop it than letting it happen and then you're trying to take care of it? So what should always be at the back of our minds when we want to take vaccines is that prevention is better than cure. Let me prevent this instead of trying to cure it.
Okay, so before we wrap up, now we're talking about vaccines. How do people get these vaccines? Where, and are they free?
Most vaccines are not free.
Okay.
But then either governments or maybe some non-government organizations could help the community, could help people reduce the prices they pay for these vaccines. And most importantly, like, where do they get these vaccines from? Hospitals, primary healthcare centers. So those are places that you can walk up to and just get vaccine. Yes.
Okay. You mentioned some NGOs, trying to offer free vaccinations, right, for people. And I think that's where I'm going to commend NGOs like Slum and Rural Health Initiative. It is one NGO that is geared towards solving health problems and issues, and we've been having vaccines outreach, like the hepatitis B vaccines and so many stuffs like that. So we must give kudos to these organizations that are trying to solve health problems. So to our listeners, vaccines are not a sign that you are sick. Taking vaccines are not a sign that you are sick or you're not healthy. It is just you trying to protect yourselves against diseases or infections that might want to surface. So it is important that you get vaccinated when you have the opportunity or access to. You don't have to wait until when you are sick or you're down. So what are your final words before we wrap up?
Okay, my final words are prevention is better than cure, and then you should also, for your health and for the community at large, try to get vaccinated. I mean, you might not know what vaccine you want to, but going to a hospital, the primary healthcare center in your community, you can just go and ask them, okay, what vaccine can I take? Because you might not know.
No, that's
but when you get there, they'll tell you, they will advise you, ask you some questions so that they can give you the advice that you need.
Oh, okay.
Yes.
Thank you so much. So wrapping up, like our nurse said, it's not just going to the hospital to get yourself treated, but hospitals are places you can go to get questions, to get answers to some questions you might have as regarding your health. So vaccines are very important. You shouldn't shy away from vaccines. Vaccines are not only for kids, it's for everybody. So long as you want to be able to fight some of these diseases that might be flying out there, and I know you don't want to be infected. So this is where I call it a wrap. Thank you so much, Nurse Divine. Thank you so much. It was so amazing having you on the show, and I look forward to having you subsequently. Thank you.
It's my pleasure. I enjoyed it.
Same here. Thank you so much.
Thank you.
So guys, thank you so much. I'm so excited to be on the show. Thank you so much for joining us on SRHIN's HealthPodcast. This is where we call it a wrap, and I'll see you in the next episode. Don't forget, your health is wealth. Don't joke with it. Thank you. Bye.